Hello, I'm going to have to redo my video on hyperpigmentation acne scar treatment because I had a lot of background noise, and when I listened to it again, it was annoying me, so I can only imagine how you guys felt. So I'm going to redo this video. I did the other one in the morning. Acne scars, acne is the blocked sebaceous glands. These are glands that produce sebum, that is a kind of oil that protects your skin. It's a kind of a skin barrier, natural skin barrier. We can get acne at different stages of our life. During puberty it starts, it can continue through your reproductive age, through your 20s and 30s, and even have them sometimes into your middle age or menopausal age, as in women. So what causes acne? Acne can be due to different causes. If our skin is not moisturized, for example. Yes, if you don't moisturize your skin, you can have excess production of sebum to protect your skin, because the skin is now dry, which the brain senses as need to be protected, and then excessive sebum. It can be due to sun exposure, it can be due to hormones, it can be due to irritants that we are applying on if we have sensitive skin. They can then get inflamed and get infected as well. So acne can be treated. So if you apply azelaic acid, they come in different strength, 10, 15 or 20%. Pola's as a 10% one. I will link the products I use. Basically, if it is not infected, you apply azelaic acid, you can call it as well, on your acne that has just appeared on your skin. To avoid it from getting further infected. Then if it does get infected, so 1 week ago, I had a couple from applying new makeup, applied azelaic and disappeared overnight. If it does get infected, you can apply 1% Clindamycin solution. You do need a prescription for that from your doctor, and consultation if you are allergic to it. Always, when you try new products on your skin, do a patch test on your hand to see any hypersensitivities are present. Now, despite all of your efforts, you do have acne. Do not pick it. Picking on acne is the biggest cause of developing scars or hyperpigmentation, especially in dark skin and brown skin. You do get hyperpigmentation if you pick on your acne. Let's say you picked it and you have scars. How do you treat? So for me, I never had a lot of acne through my life, but I do used to get it 1 or 2 around my mouth during my menstrual cycles. And about 5 years ago, I was going through depression due to various reasons, and I do have a family history of depression running through few generations, but I'm not undiagnosed. I probably am the first one who got diagnosed. And I was having bad skin because I wasn't taking care of my skin at all. So I had this bad acne. I am in perimenopause as well. As you guys may know, perimenopause is not 1 year. It's not the year your menopause stops. It's plus or minus 9 years. So I wasn't aware of it. I probably was in the beginning of my perimenopause, and I also have excessive bleeding due to my periods, which all means my hormones are imbalanced, and I was having acne and hyperpigmentation around my mouth as well. I still have pigmentation on my lips, but I don't have it anymore around my mouth. So when it was excess and I could not get rid of it, the way to go about it, you need to get it to a level where products can work. So if you have severe hyperpigmentation, none of the topical products, however patient you are, or just moisturizing and sunscreen is not going to work. Now, you do need to moisturize, because that's the first key of making sure your regeneration of your skin happens, and you do need to apply sunscreen to protect your skin so that the problem is not worse, because acne can be worsened and hyperpigmentation can be worsened by sun exposure or UV radiation exposure. And also, if brown skin gets melanoma, it is lethal. So we rarely get it, but if we do get melanoma, it is lethal. It's a type of skin cancer that can be metastatic or spread to other parts of our body. Now, when I had it, I got back on the horse. I started treatment of the basic things like my hormonal imbalance. I went on an oral contraceptive pill, first of all, to control my excessive bleeding. Second of all, to balance out my hormones. Now, how people respond to hormones are different. So you need to talk to your doctor before you decide to take anything, because I have seen some of my patients do get acne from using oral contraceptive, and some actually get good results out of it, and then their acne just settles down. So it's all about what your hormones are doing. And also, if you have conditions like polycystic ovarian disease, where you have these acne, you have excessive hair growth and irregular cycles, you need to check with your doctor to see if this is a possibility of your the underlying cause of your acne. If that is not the case, then I would say, depending on the severity, if it's a mild version, you can try topical preparation. Retinol is a very good one to treat hyperpigmentation it's called post-inflammatory hyperpigmentation, because the acne got infected, inflamed, and then now it's healed, and then it's left a scar. So that is different to melasma. You can still use retinol. With vitamin C, you have to be a bit careful, because vitamin C can irritate if you have active acne. So if you have active acne, you should avoid using vitamin C. But if you don't have active acne, go ahead, use your vitamin C, because it can brighten your skin. Moisturize your skin twice a day. In the morning, I use Neutrogena Gel Hydra Boost with hyaluronic acid. In the evening, I use a cream because I want a little bit more protection. And it's a personal choice and what works for you better. So hydration, any type of hydration is good. Number 2, retinol. I use 0.3% Neutrogena. Very good for your skin. It actually works wonders. What it does is it regenerates and renews your skin. It helps you produce collagen. It brightens your skin. So it's got multiple properties. So retinol is my top. Now, if you have severe hyperpigmentation, you need to see your doctor or a dermatologist to get a prescription for tretinoin and see if that is the best suitable. So take a consult and discuss it with your doctor. Now, how I treated mine is, because I had severe hyperpigmentation, I did a peel. I did a mesoaesthetic dermamelan peel. It has to be applied by a doctor. So it's a very potent peel, but it works for all types of skin, dark skin, sensitive skin. It does not cause any side effects. It is very expensive. It's about $1,500. It does come with a package of things, a regime to apply as well. I did follow it for 6 months. It worked well. It peeled the top layer of my epidermis. So basically all my suntan was gone. My hyperpigmentation was gone. I looked 3 shades lighter for those 6 months. Unfortunately, this was around 2019, 2020. In 6 months, it's not affordable. You cannot maintain that because it's expensive. It all was starting to come back. So as soon as it came back, I started using topical products, and that stopped it on its path. So first of all, I took care of my health. I exercise 5 to 6 days a week. I hydrate myself. This is very controversial. How much of water you need to drink, but somewhere around 2 to 2.5 liters is acceptable, depending on if you perspire excessively. Summer you may need higher. There's no defined medically evident numbers to how much of water you need. It all depends on how much of perspiration is there, what your underlying medical conditions, and what is your reason. Be careful of drinking too much. It can deplete you of your electrolytes, and it could lead you to life-threatening conditions. This is too long, so please go to part 2 for me to continue on what products to use.